Welcome back, viewers. You are still tuned into Prime Live. Join us in our conversation today as we delve into a conversation with Claire Waterhouse, who is the Regional Advocacy Coordinator for Médecins Sans Frontières Southern Africa. She joins us now to share the situation in Gaza, and what we'll also be talking about today is the current situation in terms of the healthcare that is provided at the moment in Gaza. We know that since the 7th of October, Israeli forces have pursued an all-out war on the people of Gaza, killing more than 41,500 people and wounding over 96,000 people. Now, Doctors Without Borders, or better known as MSF, and their medical staff have been treating victims of the bombing in Gaza, and that was caused by the massive bombings and the injuries that people have actually sustained because of the bombings. And since the beginning of the war, MSF teams have treated over 27,500 people and patients and people who have been injured from the violence that has been inflicted on the people of Gaza. So this evening we have an opportunity to delve into a conversation with Claire and talk to her a bit more about the situation on the ground in Gaza, as well as the situation regarding the healthcare systems. Good evening, Claire. Thank you so much for joining us on Prime Live this evening. Apologies, Claire. I think you are muted. Can you please unmute yourself?
I'm not.
Perfect.
Can you hear me now?
Yes, we can hear you now. Thank you so much for joining us on Prime Live. It's such a pleasure to be able to have you. I mean, personally, I really admire all the work that MSF does around the world, in war zones around the world, and in conflict areas all around the world. So really commend you and your team for the efforts that you provide, for all the efforts and all the aid that you provide and the healthcare that you provide for the millions of people around the world that need it. But let's start off our conversation by talking about the fact that it has been 1 year since the beginning of the war. What is the overall situation like in Gaza at the moment? I know a lot of us on the outside are getting all our information from social media, but from MSF, I think we have a unique opportunity to sit down with you and get an inside look into what is actually going on the ground.
Yeah, thanks so much. It's been a really long and difficult year, as I'm sure you can imagine, for everyone involved and for MSF as well. The situation on the ground at the moment is nothing short of catastrophic. There's really no other words for it, and I'm not sure that MSF has reacted to an emergency situation like this, a humanitarian emergency like this, in quite some time. And, we are very used to seeing terrible situations across the world. We intervene in almost all conflicts to provide humanitarian assistance and humanitarian aid and healthcare for people. But what we're seeing in Gaza at the moment is unlike anything we've seen for quite some time. The health system is almost completely destroyed. It seems that it has really been systematically attacked by Israeli forces throughout the year. So far, I think there's been 1,039 logged cases of Israeli forces attacking hospitals or healthcare facilities in Gaza, which is just, international law prohibits that, but we still see it happening regularly. And as a result, it's almost impossible to access proper healthcare in Gaza. We're doing our best, of course, but it's extremely difficult with the situation as it stands at the moment. We see that there is almost no clean water available to people who are living in Gaza. We see that there's high levels of malnutrition starting to come through, especially acute malnutrition in children. We're seeing that getting humanitarian supplies or any form of aid into Gaza is almost impossible. It's extremely difficult for us to do. Just overall, people do not have clean water, they do not have food, they do not have shelter, and they live under constant threat of death. And I think the mental toll is really unbelievably heavy. And as you said, we are only talking about what our teams are actually seeing on the ground. So these are things that we are actually seeing happening on the ground, and it's impossible to describe it completely because it is so terrible at the moment there.
It's incredibly difficult to imagine living in a reality like that, particularly for the decade and the time that we're living in. We're absolutely living through one of the biggest human rights catastrophes that we've seen in a very long time. And it's an unimaginable reality to imagine young children being under the constant threat of violence, and then once inflicted with violence, there's not enough access to healthcare for the injuries that you have sustained from the bombings or the violence that you have been exposed to, and mentally as well, for young children to be able to experience these kind of things. It's a horrific image that comes to my mind, and it almost paints the picture of this doomsday kind of reality that these people are living in. So thank you for giving us a very vivid and very insightful insight into what it's actually like to live in Gaza at the moment, underneath the circumstances at the moment. And I think when it comes to the injuries, I know that MSF has treated thousands of people in Gaza, and like you said, a lot of the time you aren't able to get to all the people and all the areas that are needed because the catastrophe, and because the need is so great, and because the healthcare is depleted so much. But are you able to give us any kind of understanding when it comes to what are the types of injuries that your team are witnessing on the ground? What are some of the major illnesses that you are witnessing on the ground when it comes to the health of the people in Gaza who are being inflicted by this kind of violence?
Yeah, absolutely. So prior to October 7th, we operated in three major hospitals in Gaza, undertaking routine activities. And since then, obviously, the situation has meant that our teams have been also displaced a lot and struggled to access hospitals. So we have, up till now, been forced to evacuate from 14 different health facilities where we've started working. So we keep going into health facilities, trying to start working, and then due to the unpredictability, due to ongoing fighting, due to threats on our staff, we have to move again. So 14 facilities means that it's been really difficult for us to set up proper work to be able to treat people. So at the moment, we are operational. We are operational in at least 6 or 7 different sites at the moment, in all three areas or major parts of Gaza, so in the north, in the middle, and in the south. Um, and the most common stuff that we are seeing at the moment is, well, firstly, there's of course the trauma and war-related injuries, the violence-related injuries. So as you mentioned, we've treated at least 27,500 wounded people as a direct result of the violence. And within that, we see terrible things. We see people who have been dismembered. We see bones that have been crushed. We see really bad burns and just terrible open wounds. Obviously, the risk of infection is extremely high because of the lack of clean water as well, which is then a whole other scenario that we have to deal with. But of course, people are also having normal health struggles as well, you know. So with the lack of clean water, with the general situation, we're seeing massive amounts of upper respiratory infections, so chest infections, especially in children. We're seeing a lot of skin diseases, a lot of terrible diarrhea and tummy related things as people struggle to access food, they struggle to access clean water, they're living in really inhumane conditions. So we see a lot of things like that. But of course, people also, people are still having babies. People are still, have their chronic diseases like diabetes or high blood pressure and those kinds of things where they need treatment. So of course, we're also seeing a lot of that. And then of course, as you would expect in a situation like that, just massive amounts of mental health issues, massive amounts of people highly traumatized, highly, just not sleeping, not eating, terrified for their lives. We're seeing children suffering with mental health more than any child should ever have to in the world. We see young children who have suicidal thoughts, and that's just, imagining what children are going through to get to that point is truly horrific.
It's a heartbreaking thing for me to hear, and I know our viewers will resonate with how I'm feeling right now, for just the visual of young children, having to undergo such levels of trauma and having to question whether they want to live or not. These are not the kinds of thoughts that children should be having. And the fact that this is happening right before our eyes is such a difficult thing to accept and process. But I really once again commend that MSF have tried to, treat as many possible people as you can, to try and aid as many people as you can. And that's exactly what I was thinking about, is beyond also the injuries that people are sustaining from the violence, there are also people who have chronic ailments and illnesses who aren't able to access the healthcare that they would need to be able to survive. But are you able to tell us a bit more about how MSF is able to provide some of the primary care to the people that you are serving in these areas? I know that you've mentioned before that MSF has had to move multiple times. 14 of the facilities you've had to move away from because of threats of violence, and of course the safety of the members of MSF who are there to assist. But can you tell us more about some of the work that you're doing and some of the primary care that you are providing to the areas that you are able to access?
Yeah, absolutely. So, as I mentioned, we now have managed to get facilities going, and in many cases we've set up field hospitals or field clinics kind of thing, or we're working in facilities that haven't been completely destroyed, which is also quite difficult because at the moment, as I'm sure you can imagine, 17 out of the 36 existing facilities or hospitals in Gaza are only functioning, and when I say functioning, I mean really partially functioning, not even close to what they should be. So within that, we try to find those facilities and support them. We work very closely with the Ministry of Health there, with other partners, civil society partners who are there. So in the north at the moment, what we're doing is we have a clinic which mainly focuses on dressings, on physiotherapy, but which are immediate kind of needs based on the conflict. But we are working to expand into more comprehensive care there. So looking at malnutrition, looking at sexual and reproductive health care, looking at chronic illness, so non-communicable diseases, and just generally trying to provide a more comprehensive primary health care as well. Then in the center of Gaza, we were operating from Al-Aqsa Hospital, but unfortunately we've recently had to evacuate there again. So now we currently provide primary health care in Deir al-Bala, which is one of the bigger areas with a lot of displaced people. And actually just very recently, in the last few weeks, we've now opened another clinic in Al-Hekar, the area is called, which again is providing more general primary health care, mental health, psychological first aid, which is what we call sort of mental health support that's urgent and the immediate things that we can do. So those kinds of services. And then obviously we have most of our operations in the south, because that is in theory the safest space, although of course we all know there's no real safe space in Gaza anymore. So there we operate in Nasser Hospital, where we are treating burns, trauma, any kind of violence related injuries. We've also now opened, in collaboration with the Ministry of Health, maternity ward there, a neonatal ICU for newborn babies who need support. And we currently have, I think, 68 beds in an ICU that we're working on there. Also within the south, we have a mobile clinic that is going around providing care. And we are working on surgical interventions as well. So being able to provide surgery, because that was what we originally did, actually, pre-October 7th. One of our big focuses was reconstructive surgery. So we also are working on being able to provide that. But of course, it is difficult. We've had our teams having to operate without anesthetic, having to operate on dirty floors in hospitals, seeing patients just die before them because they can't provide what is needed. So it's really difficult. Something else maybe to mention is that we also provide clean water. So we provide at the moment 600,000 liters of water per day in the south of Gaza through desalination units that we've set up. So we currently have one big desalination unit in the south, and we are looking at opening 2 more within the next few weeks to be able to provide a significant amount more of water. Because as we say, the clean water situation directly impacts health. Things like cholera, we're very worried about that happening. And just generally dirty water is never good for anyone. And of course, people are desperate enough that they have to use dirty water. So that's where we are at the moment in terms of what we're able to provide. But it is extraordinarily difficult for us to get supplies in at the moment. And yeah, I could talk a lot more about that, but I'll let you go ahead for now. But yeah.
Thank you for sharing that. I mean, it's incredible what MSF has been able to do and the impact you've been able to have on the people's lives in Gaza. I cannot imagine a world without MSF. It's absolutely amazing to see what you've been able to achieve in terms of providing the much needed medical care and support for the people in Gaza who so desperately need it. And in closing, I think my biggest question to you is how can we continue to support, and what is MSF's call to action when it comes to what is yet to be the greatest humanitarian crisis we've seen in forever? So please do comment on that, on your call to action. And of course, we have a public audience who is watching us this evening as well. And of course, MSF needs as much support as possible to be able to continue the work that you do in Gaza, but not just in Gaza alone, but around the world in different conflict zones and in different war-torn areas that are in dire need of your support. So please do share that with us this evening.
Thank you so much. I really appreciate this opportunity as well. So our calls to action are really, I mean, you've heard them from so many actors over time, but I'll just emphasize them. Obviously, the first and most immediate thing that anyone needs in Gaza is an immediate and a sustained ceasefire. None of these short-term things are really going to work or make a huge difference. We need a proper, sustained ceasefire in order for people to be able to start to recover their lives. We also, as a healthcare organization, are calling for an immediate stopping of targeting healthcare workers and targeting healthcare facilities. We cannot operate like this. It's against international law and it is not okay. And it's pushing everything to the absolute limit. So we immediately call for a cessation of any kind of targeting of healthcare facilities and healthcare workers. And then, of course, importantly, and as I just alluded to before, we need access to supplies with no hindrance of supplies should be happening for anything coming into the Gaza Strip. So up till now, I think we have managed to get 73 trucks of aid in for MSF. Previous to October 7th, 300 to 500 trucks were coming in a day in Gaza. We have not yet seen more than 240 trucks come in a day for Gaza, and that's a good day at the moment. We have only managed to get 73 trucks in. It's crippling us. We need access to essential medicines. We need access to the huge variety of equipment that we need in order to be able to provide care to all patients who need it. So we are really strongly calling for please open more borders, allow more trucks through. We find that the criteria that the Israeli forces and the Israeli government are setting at the moment to be extremely unclear, extremely unpredictable. Even when we do sometimes manage to get a truck in, it's really difficult for it actually to reach where it's needed because the roads are inaccessible, people are desperate, there's looting, there's so many things happening. So we need clear, safe pathways for aid to come into Gaza, and that is urgent. And then, of course, I've mentioned clean water. Clean water is critical. We cannot function without it. We need access to clean water. Every person in Gaza needs it at the moment. And we call on governments and heads of state and anyone who can, from the US, the European Union, the UK, Canada, the Arab League, everyone. Now is the time. It has been the time for a year. It will never be enough at this stage. You need to put pressure on the Israeli government to stop what it is doing and to end this immediately. So that is our call to our biggest calls to action. Let me just say, and then I so appreciate you asking what people can do to support MSF. To be clear, with or without support, we will not be leaving Gaza anytime soon. In fact, for decades, I'm quite sure. We've been present in Gaza for 20 years. We will not be leaving the people of Gaza. If people would like to support us, we would be so grateful and we welcome that. Our key principles are neutrality and impartiality. We do not take money from any government. We take money only from people like your viewers who are watching now, so that we are able to remain neutral and impartial and speak out on the things that we see without being coerced by any other government. So if anyone is interested in contributing to Doctors Without Borders, you can do so on our website. It's very easy. It's msf.org.za. And we would be extremely grateful for any kind of contributions. As you mentioned, we are also working in a variety of other conflict zones around the world. Sudan is obviously also a major concern for us. We're in about 93 countries at the moment working in humanitarian situations. So anything and everything it goes directly to our patients all over the world. And thank you so much for the opportunity to share what's happening. I wish it could be slightly better, but unfortunately the situation is truly horrific.